and welcome to our presentation. We're a group of Fairfield University nurse practitioner students, and my name is Ava Wallace.
I'm Chris Lasarenza.
I'm Pete Bramer.
I'm Molly Sanchez.
I'm Ryan Keenan.
I'm Nancy Velasco.
And I'm Mike DeMacy, and this is our presentation on overcoming barriers to food access.
This is the Monroe Food Pantry that we visited.
This is just a basic outline of our presentation.
The purpose of our project was to determine if food pantry patrons were able to eat 3 meals a day, and if not, what were the barriers. We collaborated with the Council of Churches of Greater Bridgeport and performed a needs assessment with patrons at the Monroe Food Pantry.
A shelf at the pantry. Prior to starting our project, we set up 4 objectives to meet by the end of our project, and these objectives are as follows. The first one is to state for our patrons to state if they are getting 3 meals a day, and we will find that evidence through their responses on the Patron Experience Survey. Our second objective was to see if patients were having trouble obtaining 3 meals a day, what were the barriers, and if they could list 3 of them. The third objective was to find out 2 perceived advantages of using pantries and soup kitchens as reported by the patrons. And our final objective was to develop 3 strategies that will be proposed to the Council of Churches in Greater Bridgeport by the surveying team to decrease the reported barriers.
Food security status of the U.S. household. Food secure refers to household that has access at all times to enough food for an active, healthy life for all household members. Food insecure refers to at some point during the year, these households were uncertain of having or unable to acquire enough food to meet the needs of all of their members because they had insufficient money or other resources for food. This is just some basic statistic on food insecurity prevalence based on 2014 data. About 86% of U.S. households were food secured throughout year 2014. There was not much of a change since 2013. Overall, 14% of households experienced food insecurity. Households with children had a substantially higher rate of food insecurity of 19.2% compared to 11% for those without children.
So we wanted to relate this project to Healthy People 2020 objective, and the objective we found was in the nutrition and weight status section. It was number 13, to reduce the household food insecurity, and in doing so, reducing hunger. Some of the barriers that we found through our research was that people had limited cooking and nutrition knowledge. The food quality of pantries was either low, the perishability was high, and the variety and availability was minimal as well. The mental health issues patrons can have and disabilities can inhibit the access to the services, chronic diseases that require a special diet. The special diet isn't able to be met due to the limited amount of food and types of food that's available to them. They are unaware of resources that are available to them, and the amount of food is not able to meet the needs of large families. One of the research studies that we found was based out of Hartford, and it's titled A Novel Food Pantry, and the goal was to provide a fundamental approach to solve the problem of hunger by addressing the underlying cause of poverty. Now, there are 3 steps in this intervention. The members were a part of the Fresh Place Pantry, and they were able to shop twice per month. They got to choose their own food, which preserves a sense of dignity, allowing them to exercise their freedom of choice. Members meet with a project manager who is skilled in motivational interviewing. They meet once a month and develop a plan called the Fresh Start Plan that allows one to set up personal goals towards becoming food secure, self-sufficient, and overcoming barriers to achieve those goals. Step 3 is that Fresh Place offers resources to allow and help their patrons to meet the goals that they have set. They found statistically significant findings showing that those that were in this Fresh Place program consumed more fresh fruits and vegetables, were more self-sufficient, and were half as likely to have very low food security.
further literature review showed that improving food insecurity goes beyond teaching soup kitchen consumers about traditional nutrition, but applying practical solutions such as accessible, affordable food, improving dentition, and storage facilities. Black neighborhoods have fewer supermarkets compared to predominantly white neighborhoods. Poor areas have fewer and smaller food outlets than non-poor areas. Low-income residents have limited access to supermarkets. Food prices were high in both rural and urban food deserts compared to non-food deserts. Poor residents travel a greater distance to access the same resources as non-poor residents. Many rural food outlets contained poorly stocked shelves and lack healthy and nutritious foods. Food insecure families use a number of coping strategies to delay hunger. There is a positive association between increased rates of child overweight and percentages of children in school districts residing in a food desert. As food insecurity increases, consumption of fruits and vegetables decreases. Partnerships between community clinics and food pantries combat diet-related illnesses and engage low-income individuals in healthcare. Food insecure families were more likely to obtain food from corner convenience stores, utilize food banks, require transportation other than a household car, and prioritize paying bills before purchasing food.
Food insecurity and some of the health consequences. Toxic stress is a consequence of food insecurity. In a study where 51 parents were interviewed, some of the coping strategy, as Nancy had mentioned earlier, they were alternating paying rent and utilities and food. So they'll pay rent every other month and then pay the utility every other month while trying to maintain the food supplies. And some of them have to trade off buying food to buy nebulizer for their asthmatic children versus purchasing food. Parents do recognize that the food insecurity has some negative consequences on their psychological well-being, which in turn impacts their children's growth and development as well. In regards to depression, a study has showed that the overall prevalence of depression is 9.3%, ranging from 6.7% for the SNAP non-recipient versus 12.8% for the SNAP recipients, which might have to do with the dignity and stigma of using the program. And in poor adherence to medication regimen, about 45% of people that have diabetes and food insecurity report scrimping on one or more of medications compared to the 12% of those with food security.
Considering social determinants of health in Monroe, the population in Monroe is 19,247. The average household size is about 2.9 persons, which is slightly higher than the rest when compared to Connecticut. And additionally, the income is slightly higher when compared to the rest of Connecticut. Approximately 2.6% of Monroe residents have an income below the poverty level. Monroe's unemployment rate is significantly lower when compared to Connecticut, about 3%, when compared to Connecticut's 5.3%. Approximately 95% of the residents in Monroe are of the white race, 2.5% are Hispanic, and approximately 91.2% have a high school degree or higher. Why is this important for our team, and why is this important to the Monroe Food Pantry patrons? In considering these factors, this allowed us to incorporate the needs specific to the Monroe Food Pantry patrons. Before speaking to the patrons, our team interviewed the Monroe Food Pantry site coordinator, Wendy Jawls, in considering appropriateness to the environment and the people of Monroe. This helped guide us to environmental factors, economic factors, and social and community considerations in developing the survey tool. This is a picture of one of the shelves at the pantry. Monroe Food Pantry facts. It serves approximately 650 people in the town. 312 are males, 347 are females. The pantry distributes approximately 12,000 pounds of food per month, and it provides more than 10,000 meals each month. Approximately 1/3 of the patrons are children, and the patrons will qualify to participate if the Monroe residents qualify for food stamps or heating assistance. This is the Food Pantry Patron Experience Survey that we created. It was a very basic 17-item survey tool used in English only.
Basic principles of motivational interviewing were used by our group during our needs assessment. Motivational interviewing was developed as a collaborative person and goal-centered method to elicit change and enhance a person's motivation to change. Since we were not directly eliciting change among Monroe Food Pantry patrons, but rather performing a needs assessment, we utilized the basics of motivational interviewing to gather information, as shown in the acronym OARS. Students refrained from giving any advice or making judgments and asked permission to approach patrons. Open-ended questions were included in the patron satisfaction survey, and reflections were performed by the students to ensure accuracy of data being collected. Reflective listening was utilized to develop a safe and respectful environment between students and patrons.
We spent 2 days surveying patrons at the Monroe Food Pantry. Common themes were found through 14 surveys. Some of the outcome measures that we found: 4 of the surveyed patrons state they receive all the family's food from the food pantry. Only 1 person said they do not eat 3 meals per day. This person said they skip lunch so other family members can eat. A repeatedly voiced concern was not enough protein-rich foods. All patrons voiced ability to store and prepare food. If there's one thing that was inadequate, there is not enough volunteer staff. Also, parking is limited. Patrons consistently voiced that the staff is wonderful and caring. Discrepancies between people saying they generally eat 3 meals a day and still voicing reasons that they do not eat 3 meals a day. So there were a few people that voiced that there were barriers to eating 3 meals a day. 1 person had limited income related to health concerns, and another man does not always eat in order that the children in his family could eat. The limitations at the food pantry were that there was not enough parking and that the staff always seemed shorthanded. These were not barriers for these patrons to get food or eat 3 meals a day. Here's a picture of the limited parking. What is best about the Monroe Food Pantry? Everybody knows and loves the staff, and Wendy was mentioned repeatedly as being generous, like family. I don't think we can understate how much Wendy and the volunteers mean to the patrons. And here's another picture of the food pantry.
So a needs assessment was performed through 2 rounds of surveying patrons, as well as multiple interviews with Wendy, the site supervisor. It was determined that funding is of course a very important need for the food pantry to remain successful. They receive approximately $35,000 from the town of Monroe, but that only covers utilities and general maintenance of the building. All money for the food comes either privately or through charity. Approximately $66,000 is spent on food annually by the pantry. So as you can see, Food Pantry relies heavily on the help of private donations. Additionally, food donations are what drive the pantry and what supply the patrons with their food. Unfortunately, donations can vary, between no donations in a day to thousands of pounds of donations. Our second day that we were there, the day prior, they had received approximately 1,100 pounds of food in a surprise food drive. So as you can see, it varies from day to day with how much food they're receiving. Volunteers, they rely heavily on volunteers for help at the food pantry. There are approximately 18 consistent volunteers on staff. There are some transient volunteers as well, including high school students, college students, and in between volunteers who come in and help cover as needed. 2/3 of the volunteers are retired, and a majority of the volunteers have or were at some point patrons of the food pantry. Increased parking availability was another major concern with the food pantry. Unfortunately, it is on a small parcel of land, so it is limited with how many vehicles could be parked at the facility at any given time. Additionally, the general maintenance of the building, could also be seen as a need. The house was privately donated approximately 15 years ago, and it was constructed in the late 1940s from a private resident of Monroe. And unfortunately, there have been, little updates done since the house was donated. There is a need for a new roof, new windows, and interior updates as well. Therefore, grant money or private donations are necessary to keep the maintenance of the house up and well. Handicap accessibility for patrons was another issue as well. There is a long ramp that is in front of the Monroe Food Pantry. However, it is long and winding and can be, of great exertion to some of the senior citizen patrons that do shop there. Free healthcare community services for patrons was also another need. They demonstrated that there is a need for diabetes education, high blood pressure, as well as just overall general health. And there's also just an increased awareness that's necessary for the general public of the food pantry need. And as you can see, this is just an example. This is a picture that was taken in one of the freezers, and they actually freeze the milk to preserve and keep as much as possible within the pantry, just to maximize all the donations that they receive. So in summary, 14 patrons were surveyed. As you can see, greater than 90% were Caucasian. And primarily, they use the food pantry as supplemental. They have proper food storage at their house, and the majority of patrons were able to eat 3 meals daily. Overall, everyone was very satisfied with the services, especially Wendy, the people, the organization, and the choices. Some limitations: there's one food pantry in Monroe, so unfortunately we cannot generalize this study to reflect pantry services in the greater Bridgeport communities or nationwide either. So lastly, what are some future implications that came out of this study? We would promote food insecurity screenings at community organizations. Additionally, we would recommend collaboration between Fairfield University, either undergraduate or graduate students, between various food pantries throughout the greater Bridgeport community. And this can be done for a variety of different screenings, including blood pressure, diabetes, and just general well-being screenings. This would therefore increase the health screenings for patrons, as well as promote awareness among general community of services provided. We can help by improving the amount of social media that is being used. We can promote by word of mouth the need that is there throughout the community. And our ultimate goal is to provide future opportunities for grant proposals and to guide appropriate resources to these places of need. So that concludes our presentation. We would like to say a special thank you to Michelle and Wendy, all the volunteers at the food pantry, as well as all the patrons of the food pantry. We certainly learned a lot, and we hope that this inspires the public to increase awareness and support towards this great cause. Thank you.
Thank
Thank you.
you.